Infectious diseases are leading cause of death worldwide and responsible for an estimated 8.4 million deaths annually, particularly among young children and marginalized populations. Antimicrobial resistance happens when microorganisms change in ways that render the medications used to cure the infections they cause ineffective. This has become a global health emergency. The causes of antimicrobial resistance are complex and more difficult to control in countries with weaker health systems. Resistance to pathogens that are responsible for tuberculosis, malaria, and HIV has been observed around the world, as well as to those responsible for influenza, typhoid, diarrhea, and a host of others. Dr. Adrian Gardner, a physician and executive field director at Ampath Consortium in Kenya, says, and I quote, "There are patients dying from infections that can't be treated with antibiotics. We really don't know how big the scope of the problem is at this point," end of quote. According to Gardner, pharmacies in Kenya sometimes run out of stock and substitute antibiotics. Patients also risk being provided substandard medicines, a common occurrence across sub-Saharan Africa. Kenya has already achieved important progress in tackling antimicrobial resistance. It is one of 11 African countries that has developed a national action plan on antimicrobial resistance. However, it is still facing several significant challenges. Among them are the burden of infectious diseases, lack of trust in the medical system, and inadequate access to quality drugs, according to Global Antibiotic Resistance Partnership. Each November, World Antibiotic Awareness Week, which runs from 18th to 24th November this year, aims to increase global awareness of antibiotic resistance and to encourage best practices among the general public health workers and policymakers to avoid the further emergence and spread of antibiotic resistance. Winnie Lubembe for Ebru TV.